Thank you to the Aesthetic Surgery Journal for choosing our paper, Heavy Metals in Breast Implant Capsules and Breast Tissue, Findings from the Systemic Symptoms in Women-Biospecimen Analysis Study, as the editor's choice. Why did we look at metal exposure to women with breast implants? Well, patients with breast implant illness have very significant symptoms that they attribute to their implants. Our first paper showed that these patients' symptoms did at least partially improve after implant removal. And the question is why? In talking to our breast implant illness patients and patient advocates, they often refer to the possibility of heavy metals as a potential cause. We could not find any published papers that looked at heavy metals in implant capsules. We felt this was an important thing to study. Part 2 of the Systemic Symptoms in Women-Biospecimen Analysis Study looked at whether heavy metals are present in the capsule around both saline and silicone gel implants, as well as the breast tissue of women who never had implants. We wanted to see if there were any statistical differences in the type or level of these metals between women with or without symptoms. As we previously published this in part 1, this is a prospective blinded study which enrolled 150 consecutive subjects divided equally into 3 cohorts. Capsule tissue was removed from the breast implant illness and non-breast implant illness cohorts, and breast tissue was obtained from women with no exposure to any implanted medical device. Specimens were sent blinded to Eurofins labs for analysis of heavy metals. So Caroline, why don't you talk about what we found?
Okay, so this study is the first study to provide an in-depth analysis of the metal content, as Pat said, in breast implant capsules surrounding both saline and silicone breast implants, as well as the breast tissue from a control group of women who had never had exposure to any implanted device. We enrolled 150 patients between 2019 and 2021. Our 1-year follow-up is currently at 94% in the BII cohort, 76% in the non-BII cohort, and about 74% in this control mastopexy group. The metals detected in the capsules of both cohorts and the control tissue were all well below what is considered to be safe exposure. Platinum, which has been an issue for many years, was detected in only 1 of 50 patients in the BII cohort and only 1 patient in the non-BII cohort. Some metals were actually detected in the non-implant control group breast tissue to be numerically higher levels than in either of the breast implant cohorts. So the presence of heavy metals in healthy, normal breast tissue supports this hypothesis that age-matched controlled subjects have similar environmental exposures through ingestion, inhalation, and absorption of metals through the skin. Other potential etiologies have been discussed besides heavy metals, such as silicone from gel bleed or rupture. And silicone can pretty much be excluded as a causative factor with a pretty high level of confidence based on the observation that BII is reported similarly in patients with both saline-filled implants and silicone gel breast implants. And saline implants contain 1/100th of the level of low molecular weight siloxane, as do silicone implants. In this study, the BII cohort had statistically more smooth saline implants than silicone. Pat, why don't you talk a little bit about where this leads for our patients?
Yeah, for patients doing research on potential sources of their systemic symptoms that they relate to their implants, seeing heavy metals listed as an ingredient of their breast implants on social media or on a table on the FDA website without any context is an understandable cause for concern. And it's a reason many patients and some surgeons suggest a total capsulectomy is necessary in treatment. This study analyzed 200 capsules in normal breast tissue for the presence of 22 heavy metals, and we concluded there's not a significant risk of heavy metal exposure from breast implants and breast implant capsules with either saline or silicone implants. Therefore, the risk of heavy metal toxicity should not be used as an indication for total capsulectomy.